Dr. Irina Suarez. It's a great pleasure and honor to be here today. I'll be talking about viruses in the rest of lung cancer prevention and treatment. Lung cancer is the most common cancer in men and the second most common in women worldwide. It is the leading cause of the front cancer in men. Regarding risk factors, the main one is tobacco, others are exposure to asbestos, domestic use of biomass fuel, genetic environmental contamination factors, and chronic disease and infections. Recent reports suggest that viruses such as HPV, Epstein-Barr virus, and measles virus may play a role in lung cancer. However, knowledge of the role of viruses in the pathogenesis of lung cancer is still rudimentary and has been poorly disseminated. The COVID-19 pandemic has shown that lung cancer patients are at high risk of SARS-CoV-2 infection with an increased risk of complications and death. Likewise, SARS-CoV-2 also produces an exacerbated immune reaction and lung injury that could induce long-term tumorigenesis. Viruses and their relationship. The Global Cancer Database provides estimates of the incidence and mortality rates of 36 types of cancer and include data from 185 countries. This data was analyzed by Martel, which reported approximately 2.2 million cancers attributable to infections in 2018 worldwide. The main infections agents related to cancer are those we see in the table. Interestingly, EBV, HPV, HCV, and HBV have previously been shown to be the four major cancer-associated viruses. Smoking has a potential role in increasing the susceptibility of lung tissue to viral infections and affect the function of oncoproteins. Studies in mouse models show that tobacco smoke alters the immune response, contributing to viral pathogenesis and causing deterioration in lung function. We see in this table the oncogenic viruses HPV, EBV, HIV, cytomegalovirus, CMV, and MV, as well as the less understood viral agents, the Yacheta ship retrovirus, JSRV, and the John Cunningham virus, JCV, which have shown oncogenic transformation in cell lines or animal models, particularly murine or rat models. HPV. 200 types of HPV have been described. HPV types 16 and 18 are responsible for 70% of HPV-related cancer. The HPV genome includes an early E region that encodes the proteins E1, E2, and E4 to E7. E6 and E7 are oncoproteins that act as factors that stimulate the proliferation of host cells. These oncoproteins improve tumor development by promoting the cell cycles and inhibiting apoptosis. A recent systematic review and meta-analysis included 78 studies with data from 9,385 patients, examining the presence of HPV infections in lung cancer, which was detected in 1,268 cases. This data and other reports of oropharyngeal cancer worldwide may suggest a possible route of HPV transmission from the oropharyngeal airways to the lungs. A possible hematogenous route has also been detected. EBV is associated in a particular subtype lung carcinoma which affects younger non-smokers more frequently, particularly in the Asian population. It has also been found in NSCLC squamous cell carcinoma patients and lung adenocarcinoma. A study investigating the variation between EBV and severity, exacerbation, and progression in patients with bronchiectasis found that people who had EBV DNA had a significantly faster decline in lung function and a shorter time before the following exacerbation, suggesting a possible relationship between EBV and the progression of bronchiectasis. This suggests that EBV latency could facilitate the progression from chronic lung disease to lung cancer and vice versa, since prior cellular alterations are a necessary precondition to establish a latent EBV infection. People living with HIV have a higher risk of developing lung cancer. A French study analyzed 84,504 people with HIV. It was shown that the increased risk of lung cancer was related to not recovering a CD4 count greater than or equal to 500 cells per cubic millimeter once antiretroviral therapy is started. Another study in the United States of 322,675 cancer patients during the period 1977 to 2002, lung infection was found to be associated with an increased risk of developing lung cancer 10 years after the onset of AIDS. CMV. It is a herpes virus that has a high prevalence in the community. CMV pathogenesis of lung cancer depends on oncomodulation through oncogenes proteins PUL123, PUL122, and PUS28. In a recently published series of 144 consecutive cases of malignant pleural mesothelioma, immunoglobulin G against CMV was detected in 51% of the cases. Acute MV infection is usually followed by transient cellular immunodeficiency despite lifelong protective immunity. One study detected MV antigens in 54 of 65 cases of NSCLC. Interestingly, high expression levels of MV antigens were found in patients older than 60 years. Prevention of infection by oncogenic viruses is complicated since, with the exception of HPV, there are no approved vaccines for the viral agents described. Therefore, it is recommended that once chiral infection is detected, strategies are taken to avoid viral activation to block or reduce oncogenic transformation. COVID-19 and lung cancer. This letter published by Kelly shows that the possible oncogenic mechanisms of SARS-CoV-2 in the development of lung cancer are those listed 1 to 3. This could be involved in the potential development of lung cancer. Conclusion. Although based research studies have demonstrated possible oncogenic mechanisms of viruses and lung cancer cell lines, more research is needed. Smoking may contribute to viral oncogenesis by producing local immunosuppression and increases viral pathogenesis. Thanks for your attention.